Over 60 and feeling like your morning vitality has faded away? Most men blame age, their heart, or even testosterone. But what if the real culprit isn't in your chest? It's in your mouth. Bleeding gums, loose teeth, or even bad breath may seem harmless. But science now shows they can secretly inflame your blood vessels, block circulation, and drain the very strength that makes you feel like a man. I'm Dr. Evelyn Hart, and in this video I'll reveal the hidden link between oral health and blood flow. Stay with me, because what you're about to discover will completely change the way you think about your gums, your heart, and your vitality. Gum inflammation and blood vessels. Not long ago, I met Alan, a 67-year-old grandfather who thought his bleeding gums were just part of getting older. Every morning when he brushed his teeth, the sink turned pink. He shrugged it off. After all, what harm could a little gum bleeding do? But Alan also noticed something else. His mornings felt weaker, his stamina was fading, and he couldn't remember the last time he woke up with the same vitality he had in his 50s. He blamed age until we looked deeper. Here's the science most men never hear. When your gums are inflamed, they're not just swollen in your mouth. That inflammation opens tiny pathways for bacteria to slip into your bloodstream. Once there, these bacteria irritate the lining of your arteries, triggering inflammation far beyond your gums. A study from the American Heart Association has shown that men with periodontal disease are significantly more likely to develop cardiovascular issues. Why? Because inflamed gums spark the same kind of inflammation in blood vessels, making them stiffer, narrower, and less able to carry blood where it's needed most. For Alan, the connection became clear. His gum disease wasn't only about his smile, it was about his circulation. The bacteria in his mouth were fueling systemic inflammation, silently reducing blood flow throughout his body. And when blood flow weakens, the first place men notice it is in their mornings. When he finally began treating his gum disease, the change was remarkable. His dentist worked on the infection, he improved his oral hygiene, and within months, his energy and confidence returned in ways he never expected. And here's the mini hook. What Alan discovered next shocked him even more. Gum disease doesn't just inflame your arteries. It can also interfere with the very hormones that fuel male vitality, chronic gum disease, and testosterone. When Alan began treating his gum disease, he asked me a question that many men over 60 wonder silently. Doctor, can my gums really affect my hormones too? The answer is yes. And the connection runs deeper than most realize. Chronic gum disease, also called periodontitis, isn't just about bleeding when you brush. It's a constant, low-grade infection that keeps your immune system on high alert. Over time, this steady inflammation doesn't stay in your mouth. It spreads through the bloodstream, creating what scientists call systemic inflammation. Why does that matter? Because systemic inflammation interferes with the body's ability to produce and regulate testosterone, the very hormone that fuels energy, muscle strength, and male vitality. When the immune system is busy fighting gum bacteria, it diverts resources, producing inflammatory chemicals like cytokines that blunt testosterone production in the testes. Research backs this up. A study published in the Journal of Periodontology found that men with chronic gum disease had significantly lower testosterone levels compared to men with healthy gums. Another study in clinical endocrinology confirmed that inflammatory markers in the blood are directly linked to reduced testosterone levels in aging men. For Alan, this was the missing piece. It wasn't just that his gums were inflamed. That inflammation was quietly dragging his hormones down. He told me, "I thought low testosterone was just part of aging. I had no idea my mouth was part of the problem." The impact on his life was clear. Low testosterone meant less motivation, weaker muscles, and mornings without the energy or confidence he once had. He had blamed age for years, but the truth was more specific and more fixable. By addressing his gum health, Alan wasn't just protecting his heart and arteries. He was also reducing systemic inflammation, giving his body a chance to restore its natural hormone balance. As his gums healed, his energy improved, his mood lifted, and he began to feel like himself again. And here's the mini hook. What surprised Alan next was that even the simple act of losing teeth, something so many men over 60 accept as normal, can quietly weaken blood flow and vitality in a completely different way. Tooth loss and nutrition for blood flow. Alan's story didn't end with gum disease and low testosterone. Like many men his age, he had already lost several teeth over the years. At first, he brushed it off as just another part of aging. "I can still eat soft foods," he said. "I don't really need the tougher stuff anymore." But this too had hidden consequences. Tooth loss often forces men to change what they eat. Softer, processed foods replace crunchy vegetables, leafy greens, and nuts. Over time, this shift can strip the body of the very nutrients needed to keep blood vessels open and responsive. Here's why that matters. Vegetables like spinach, lettuce, and beets are rich in nitrates, which the body converts into nitric oxide. Nitric oxide is the molecule that relaxes blood vessels, improves circulation, and supports morning vitality. Without enough nitrate-rich foods, nitric oxide production falls, blood flow weakens, and the body struggles to deliver oxygen where it's needed most. Scientific evidence supports this. A study in the American Journal of Clinical Nutrition showed that diets lacking in fruits and vegetables led to significantly lower nitric oxide levels and impaired vascular function. Another paper in Nutrients emphasized that tooth loss is linked to reduced dietary diversity and poorer cardiovascular outcomes. For Alan, this realization was sobering. His missing teeth weren't just a cosmetic issue. They were reshaping his diet and slowly starving his circulation of what it needed to thrive. He confessed, "I never thought skipping salads could hurt my blood flow. I thought it was just about my smile." The solution wasn't complicated, but it required awareness. Alan worked with his dentist to explore dentures and implants, making it easier to chew fiber-rich vegetables again. He also added simple foods he could handle: smoothies with spinach and berries, cooked carrots, and beet juice. Within months, he felt his stamina return, and those quiet mornings began to change. And here's the final mini hook. When you put these pieces together, gum inflammation, systemic hormones, and nutrition from your teeth, the lesson is clear. Oral health and blood flow are inseparable. Alan's journey reveals a truth every man over 60 needs to understand. Your mouth is not separate from your body. It is the front door to your bloodstream. And the state of your gums and teeth can quietly decide the health of your circulation and your vitality. When gums are inflamed, bacteria slip into the blood and trigger vascular inflammation, narrowing the very arteries that should carry life-giving flow. When gum disease becomes chronic, the constant immune battle lowers testosterone, draining energy and strength. And when teeth are lost, the diet shifts away from nitrate-rich foods, starving the body of the raw material it needs to produce nitric oxide, the molecule that opens blood vessels and fuels morning vitality. The lesson is simple but powerful. Oral health is vascular health. By protecting your gums, treating infections early, and keeping your teeth strong enough to enjoy vegetables and fiber, you're not just protecting your smile, you're protecting your circulation, your hormones, and the very sense of manhood that makes life worth living. Your vitality doesn't fade just because of age. Often it fades because of neglect. And that's something you can change starting today. If you've overlooked your gums or teeth until now, let this be the wake-up call. Your oral health is not just about chewing or smiling. It's a cornerstone of circulation, hormones, and vitality after 60. Tonight, Take one simple step: floss, brush thoroughly, or schedule that dental checkup you've been putting off. Small actions build into powerful protection. If this video gave you clarity, please click like. It helps more men over 60 discover this life-changing connection. Don't forget to subscribe for more doctor-backed insights on blood flow, vitality, and confidence at your age. In the comments, type the word gums. If you'd like me to share a simple oral care checklist designed specifically for men over 60, I read every comment, and your feedback guides the next videos we create together. And in the next video, I'll show you 5 daily foods that directly boost nitric oxide and circulation. A perfect partner to keeping your mouth and blood vessels healthy. Stay tuned. Disclaimer: this video is for educational purposes only and does not replace medical advice. Always consult your dentist or physician before making changes to your oral care or health routines, especially if you have gum disease, heart conditions, or are taking prescription medications.